You're listening to Soundside. I'm Libby Denkman. Quick note to listeners, the following story discusses child abuse and death. Unnecessarily removing a child from their home is harmful, and historically, child welfare workers were much more likely to take Black and Native American children away from their birth parents than other kids. So over the last several years, Washington state made policy changes to keep more birth families together. But now critics say those changes have gone too far and made children less safe, and they should be reversed. KUOW's Eilish O'Neill reports.
The first time Mariah got pregnant, she was 20 years old. She was addicted to heroin and living in motels. She gave birth at Valley Medical Center in Renton. Child Protective Services told her she couldn't bring the baby home. Instead, Mariah's aunt took the baby.
It was a really hard time. You took my daughter away. When I was in my addiction, my only way to cope with that was just to dive deeper into my addiction.
That was back in 2016. The next time Mariah got pregnant, she was determined to do things differently.
I was like, I'm trying to do this. I'm gonna go through all the things. And I had gotten on methadone. I had set up a little area in my mom's house. I had done literally everything I needed to do.
KUOW is not using Mariah's last name to protect her children's identities. When Mariah's second child was born, he tested positive for methadone. That's a medication that helps people stay off drugs. The hospital called CPS to let them know. At first, the CPS worker agreed to Mariah's plan of taking her son home to her mom's house. So Mariah put him in his car seat in the hospital room and waited for the nurse to bring her the discharge paperwork. But instead of the nurse, the CPS worker came back.
I'm like, why is she here? And my heart just kind of dropped.
The caseworker told her she wasn't sure the baby would be safe with her. She worried because Mariah had gotten off drugs so recently, and CPS hadn't had time to fully evaluate Mariah's mom. At the time, those concerns were enough to seek a court order to separate Mariah from her baby. So Mariah's aunt, the one caring for her first child, came to get the baby. Here's Mariah.
They had already had it set up, like a conversation without me being even involved. I definitely felt like I was just looked at like I was a drug addict and not a mother.
Mariah walked her baby in his new car seat out to her aunt's car.
There it was again. I just left just hopeless. That day I really thought I was going to take my son home. And so I had to go back home and look at my son's nursery area, and he wasn't there.
Mariah is part Native American, part Latina, and part Filipino. People with Native American ancestry are the most likely to lose custody of their kids. Losing her second child left Mariah demoralized. She'd gone into treatment, gotten clean, but still, the state wouldn't let her keep her baby.
That pushed me more into my addiction.
Within a month, Mariah relapsed. Since this happened, there have been 2 major policy changes in Washington state that help parents struggling with addiction keep their babies. Before 2022, hospitals generally called CPS if a baby tested positive for drugs or if a baby tested positive for medications that help people stay off drugs. But now, providers can use an online tool to check if they need to call CPS. Also, since 2023, CPS workers now have to prove that a child could imminently suffer physical harm before a judge will sign off on taking that child from their parents. And judges now have to consider the harms of family separation as well. Tara Urs is a public defender. Her clients were parents being investigated by the state. She's an advocate of kids staying with their birth parents.
There's sort of a widely held idea amongst judges that if we place a child in foster care, they're going to have a great life. And we know from a lot of research that even when children are living in a difficult situation with their families, losing connection with those people who love you is incredibly hard for children.
Research shows that in cases where social workers disagree about what to do, children left with their families do better. Here's Tara Urs again.
Children who were removed had lower overall lifetime earnings, higher teen pregnancy, higher rates of youth incarceration, just a lot of, negative life outcomes.
Other research has found that when a child is separated from their parents, stress hormones flood their brain. That can make their brains permanently more reactive and less able to learn and connect. Also, children who are removed from their homes can experience a severe form of trauma, not only because they've been forced apart from their parents, but also because they're usually left wondering why they're in foster care and how long it will last. So, family separation is harmful. Also, foster care is not always safe.
Bad things do happen to children in foster care.
As many as 1 in 3 children in foster care report abuse or neglect. Even more report not enough food or inadequate clothing. Urs says middle-class families struggle with drug use and mental health issues too, but CPS rarely separates them from their kids because money and social support keep the kids safe and provide for their basic needs despite the parents' struggles. That's what she wants to see happen for families in poverty as well.
If poverty is the problem, then money is the solution. If a referral to daycare and a grocery voucher and driving you to therapy is going to allow you to keep your child safe, that's a lot cheaper than a court case with lawyers and judges and social workers and, that goes on and on and on, plus paying for foster care and family separation. It's also better for kids.
Child welfare workers say they are trying to keep families together. They drop off bassinets, cribs, and bunk beds. They give families gas cards and grocery vouchers, drive them to medical appointments, refer them to subsidized daycare. They give them lockboxes for their drugs, Narcan to reverse overdoses, and education about the danger of opioids to babies and kids. But they say as hard as they try, some kids still aren't safe with their birth families. And now, some say, the bar for family separation is too high, and kids are being left in unsafe homes. I met Danette Scott in Burlington, Washington, about an hour north of Seattle. She was in her living room with 3 of her dogs.
So that's Moses and Job and Angel's you can see her little ears.
Danette's house is full, and not just with pets. She's had custody of her 2 oldest granddaughters, now teenagers, for years. In April 2022, her daughter Juliette had another baby named Avril. Danette decided to let them move in, too.
I want to give, Juliette every opportunity to redeem herself as a mother to the other girls. I felt like I could really help with Avril in many ways, just keeping the stress off of Juliette, because I know when you're freshly into recovery, stress can be a trigger.
Juliette was using drugs right up till Avril's birth and went into treatment after she was born.
Avril was just a sweet baby, so spending time with her was just a lot of fun.
Danette, the grandma, says she took little videos of baby Avril.
Crawling around on her scooter, laughing, playing with the dogs.
But it didn't last. Juliette, the mom, relapsed, and Danette, the grandma, called CPS. She wanted custody of baby Avril, but that's not what the CPS worker offered.
She says, Avril's in a safe home. I have no concern about that.
After all, baby Avril was with her grandma Danette, who doesn't do drugs and was helping take care of her. This was in December 2022, about 6 months before the new law would come into effect and make it harder to take kids from their parents. But child welfare workers say it had already become the de facto policy.
She says, well, there's nothing really that we can do.
After the caseworker left, so did Juliette, taking baby Avril with her. Danette didn't hear from them again until nearly 6 months later, when her daughter called her from the hospital. Baby Avril, 13 months old, had been exposed to fentanyl and was unconscious on life support. Danette got in her truck and started driving south.
And I get there and, there's probably 7, 10 people working on Avril, and they're Chaplain came and talked to me, and then I was like, oh my God, she's actually dead.
She wasn't, not yet, but she died later that night. Danette asked if she could say goodbye.
I went in and, just gave her a kiss and told her goodbye and that we love her and we'll see her soon. And it was okay. She's not going to have any more pain.
A state report confirms the details of baby Avril's story. Her grandma, Danette, blames what happened on Washington's new child welfare policies.
This Keeping Families Together Act is what's killing a lot of these babies, because Avril would still be alive if they would have just that day said, Juliette, while you're using, you're testing positive, we're going to leave the baby under your mom's care. I could have called the police when she tried to leave, and Avril would still be here and she would still be alive.
I talked to a lawyer who works with moms like Juliet about Avril's story. He said it's true that under the new law, Juliet could likely keep her daughter, and that under the old law, it would have been more likely for her grandma Danette to get custody. But that doesn't mean the state couldn't have gotten involved. The caseworker could have made a safety plan with the family. That would have put the courts in charge of making sure baby Avril stayed in her grandmother's house. In fact, since June of last year, Washington state has required formal safety planning whenever a parent is addicted to opioids and has a child under 3. So baby Avril's story would not unfold the same way now. Danette showed me a slideshow she made to help remember her granddaughter.
She was actually a living human being that deserved better. She deserved to live a happy life. She's got a happy family. It would have been a safe, not just a safe, but a thriving environment that she could have had a great life.
Since the state made policy changes to keep more families together, fewer kids have been taken from their birth families, especially infants. But over the same time period, more babies and children of families who've been investigated by CPS have died.
Kids are being left in unsafe situations.
Jeanette Obelts is a child welfare supervisor in King County and chair of the Child Welfare Policy Committee of the Washington Federation of State Employees. In the last 3 years, 52 kids died after their families had been investigated by child welfare workers. I read the reports for each death. In some cases, the committee reviewing the case said there was nothing the social worker could have done to prevent the death. But in other cases, CPS workers saw active safety threats but made no effort to take custody of the children. And at times, they made crucial mistakes. Take the case of a 6-week-old baby who died of exposure to fentanyl and meth. The department said at a decision-making meeting that the newborn had tested negative for fentanyl, which was wrong. And the caseworker was told to make a safety plan with the family, but never did. In many of the cases where a worker could have done more or made a mistake, they were new to the job or overwhelmed by their caseload. Here's Jeanette Obelts again.
We, as a union, testified against this legislation because it gave us 0 additional caseworkers.
Obelts says the department is short-staffed, burnout is high, and people leave all the time. So often social workers completely new to the job are being asked to work complicated cases. A spokesperson for the state's child welfare agency responded that in 2025, turnover was at its lowest point in 5 years, and the department has asked the legislature for funding for more caseworkers. Some of the state's reports about children's deaths describe extremely troubling situations, but say they didn't meet the new legal standard for the state to intervene, that is, imminent physical harm. In one case, a teenage mom in Yakima struggled to understand what to feed her baby and toddler and how much. The family lived with more than a dozen cats, and the mom couldn't manage to keep the home clean of cat feces and urine. And whenever social workers came by, her toddler was in her crib, alone in a dark room. I checked with a child welfare worker and a public defender who both told me that in the past, these kids would likely have been separated from their mom. But because of the state's policy changes, they weren't. Here's Jeanette Obelts again.
There is no technically immediate, imminent risk of physical harm. But we know from research that a child raised in that kind of very neglectful environment, there are long-term brain development consequences. There are long-term emotional harm consequences.
In the end, the younger child, a 7-month-old baby, died, and her 2-year-old sister was found near death, suffering from extreme malnourishment, and was life-flighted to Seattle Children's Hospital. The state's child welfare agency declined to comment on this specific case. But since this happened, the region's child welfare office has changed its policies about what to do when a parent doesn't want services but is clearly unable to care for her children. Obelt says what's currently happening is that CPS workers often walk into homes they believe are dangerous for children, but they feel they can't prove an immediate safety threat, so their hands are tied. They have to leave the child.
Every single worker goes into this work to keep kids safe, and that's our job. Most workers around the state, when I talk to them, feel like they're failing at it.
The job CPS workers are tasked with is impossible and heartbreaking. Ideally, kids would stay with their birth parents, but what if those parents are abusive or negligent, leave fentanyl on the floor, forget to feed their kids? Advocates for parents say most of those families just need help and support, but CPS workers say they're in the terrible position of having to figure out if the situation is so bad the child might die. That's the question they're asking themselves when they walk into a home, and they're aware that whatever decision they make could be incredibly damaging. The evidence seems undeniable. The law changed, and more children have died since, so it must be because of the law. But proponents of keeping more kids with their birth parents say that's not quite right. The State Department in charge of child welfare points out deaths were increasing before the policies changed, and a big part of that has to do with the opioid crisis and the sheer number of parents suffering from addiction. Tana Sen, the agency's secretary, talked about that at a press conference in June 2025.
Opioid access and use in the entire epidemic is a huge factor.
Sen said, in communities where more people are using opioids and dying of overdoses, more children are also dying. Adam Balut is a public defender and a founder of the First Legal Clinic, which helps birth parents. He says anytime caseworkers are concerned, they can still ask a judge for family separation, even under the new law.
The department still retains full power to file on every single family that they investigate.
And Balut says family separation doesn't necessarily prevent deaths. It seems intuitive that taking more kids out of struggling homes would reduce the number of children who die, but the numbers don't show that. The year the most kids died was back in 2012, way before the Keeping Families Together Act. At that time, caseworkers took nearly twice the number of kids from their families as today. So Balut says more family separation isn't the answer.
The solutions for this crisis aren't necessarily very sexy. They involve funding resources. They involve funding housing, making treatment available for families that need it, and expanding access to treatment, safe storage.
Balut says also, someone who has the power to take your kids away from you isn't the best person to offer help. When parents are being investigated by CPS, they often don't feel safe to admit what their problems are, what their needs are, how someone could help.
That parent might say, I need nothing, to the social worker, fearing that giving an honest explanation of what they do need could be weaponized against them. To say, and they didn't even have a bassinet or they didn't even have a crib ready. And so who is approaching families and offering help matters.
Back in Renton, after Mariah lost custody of her second baby,
I kind of just gave up. I lost all hope.
She went back to using, got pregnant a third time, and lost custody of that baby too. She wouldn't leave her baby, so hospital security escorted her out. In 2023, her aunt adopted all three of her children. She found out from her aunt's Facebook page.
I looked at her profile picture and they were at the courthouse wearing shirts that said, I finally got you forever, or something like that.
Then, in late 2023, Mariah found out that she was expecting her fourth baby. Just like with her second baby, she was determined to do things differently. And this time, the law was on her side.
I also went in there with the mindset of, like, I'm going to bring my baby home. Like, I'm going to be his mom. He's going to know me. I'm going to raise him.
Mariah went to a short treatment program for pregnant people at Swedish Hospital. And then from there, she went to a 6-month residential program. She got out a month or so before her due date in June 2024. and she and her partner, the father of all 4 kids, set up a home together. He'd gotten sober shortly before she had. Mariah had delivered her first 3 babies at Valley Medical Center in Renton, but for her 4th baby, she decided to schedule a C-section at Swedish First Hill.
I think one of the best decisions I could have ever made was having my son as Swedish. It was just way more compassion. I really felt like they wanted to see you succeed there. I didn't feel any judgment from any of the nurses. It was just a way different experience.
After she delivered her baby, a hospital social worker asked her about her living situation and how long she'd been clean. Then the social worker told Mariah everything seemed fine. She wasn't going to call CPS.
I think I cried, actually. I get to walk out of the hospital with my baby. I'd prayed to God, multiple occasions asking to, have another chance to be a mother. When the social worker was like, yeah, there's no problem here, I was like, well, that's God answering my prayers.
As Mariah and her partner got ready to leave the hospital, they had trouble figuring out their son's car seat.
It was giving me anxiety because I was like, I want to get out of this hospital with my son. And it was bringing up old memories of not being able to leave. I had to go in the bathroom and breathe through it.
They figured out the car seat. CPS didn't come, and a nurse walked them out to the car.
I just remember feeling so many emotions on that ride home. I was scared and excited, and once we stepped foot in the house, I was like, okay, we're good, we're safe, we're doing this,
These days, Mariah and her partner clean houses for a living. They're renting a room in a house in Renton with 3 roommates, and they're saving up to buy a car. Their son is 1.5 now.
Anna, this is...
Can we get your little socks on, Bubba? Thank you.
Oh,
Thank you. You're so sweet. No, not in the mouth. I don't know where those rocks came from.
Mariah's also trying to see her 3 older children more often. She says she does it less these days, but at first, whenever her baby made an unexpected noise in his sleep, she'd rush to go check on him.
My dad's like, you baby him so much. I'm like, because he's my baby. I have to. I have to make sure he's safe.
Eilish O'Neill, KUOW News.
Eilish O'Neill reported this story while participating in the 2025 Child Welfare Impact Reporting Fund of the USC Annenberg Center for Health Journalism. The fund provided training, mentoring, and funding to support the project. The audio for this story was mixed by Hans Tweit. Thanks for listening to Soundside. Don't forget you can listen live on KUOW 94.9 FM Seattle at noon and 8 p.m. Monday through Thursday, or anytime online at KUOW.org or on your favorite podcast app.